Speak now to UNICEF Mozambique spokesperson Guy Taylor, who is on the line to us from Xai Xai in Mozambique. Guy, a very good evening to you, and thank you so much for speaking to us.
Thank you. Thank you for having me.
What situation are you being confronted with in Xai Xai, but also if you're getting any information about the total death toll as a result of the floods in Mozambique?
Thank you. Yes, it's a very difficult situation here in Xai Xai. As you described just now, we've seen very serious flooding across the southern part of the country, and Xai Xai hit one of the hardest hit places in southern Mozambique. In just the past week, there has been around 700 millimeters, so about 70 centimeters of rainfall here, and that's led to a really serious flooding emergency. We know that about 500,000 people have been impacted so far, many of those children, about 50,000 people forced to flee their homes, and we've been seeing the impact of that here today on the ground. One of the biggest challenges at the moment is lack of access to some of the hardest to reach people. Many roads have been cut off. Over 300 kilometers of road network in Mozambique has been put out of action through the flooding, and that is presenting a serious challenge for the humanitarian response at the moment.
And just in terms of the total number of fatalities, we're getting a number of 100 that have died in Mozambique. Are you getting those figures? If not, what figures are you seeing in terms of the reported death toll?
I believe so. The numbers, the most authoritative source of numbers is the government of Mozambique, and the numbers I've seen for deaths at the moment are lower than that. I think it's testament to the efforts that have been put into early warning systems and in disaster planning, providing people with information on how to stay safe during flooding, and that has resulted in, I think, a lower death toll than we've seen in some previous disasters in Mozambique, but still certainly having a major impact. And what we're particularly concerned about as UNICEF is the impact on children and the impact over the medium and longer term. So we have huge amounts of standing water here. We're very worried about the risk of waterborne diseases, of typhoid, cholera, malaria, diarrhea, some of the biggest killers of children, but also the prolonged lack of access to some of the critical services that children need to stay alive, to stay healthy, and of course to stay learning with education. So many challenges facing the people of Mozambique in this part of the country.
And just to focus on that, I understand from reports that about 126 schools or more have been damaged and destroyed, including health facilities. So that surely must complicate your ability to keep children safe, keep them in school, and actually give them the necessary health emergency that needs to be afforded to them. So what are you doing? And I also want to understand the early warning systems, what mechanisms are in place to prevent further deaths or displacement.
Yeah. So what UNICEF would typically do in a crisis or a disaster like the one we're seeing in here is we will quickly bring in large quantities of essential supplies. So things like water purification tablets, water storage, supplies, medicines, things that children can use, recreational kits, so that children can have a sense of normality and play. And we also bring in big, sturdy tents, which can be used as classrooms, as health facilities, temporary clinics. So that work is underway to get those supplies on the ground and distributed to the areas where they're needed the most. And then, of course, we support the government response and coordinate with humanitarian partners to get those services back online. So to make sure that children are having access to some form of learning, to make sure that, for example, children who are suffering from severe acute malnutrition, which can kill children in a matter of hours or days, are receiving the treatment that they need. In terms of early warning systems, there's been a lot of efforts around that in recent years. As I'm sure you're aware, Mozambique is now being hit on a pretty much an annual basis by tropical cyclones. Indeed, we were hit by three last year in one cyclone season. And the government and organizations like UNICEF are doing a lot of work to send information out to people through SMS systems, through on the ground mechanisms, going around with megaphones and telling people about how to find safety. and also about making information online available around how to, for example, to protect yourself during flooding, how to keep safe during the cyclone, and things like that. And I think that is paying off in terms of lives saved and reductions in property damage. So it's one positive within this. Very concerning trend of increasing climate shocks that are hitting this country and the region.
And speaking of increasing, you did mention earlier on the advent of diseases, waterborne diseases such as cholera. Are there fears of there being an even wider outbreak given these current conditions? And I also would like to understand, I know you're doing your part, but is there a shortage of temporary accommodation?
Certainly, there's a very real threat of cholera. Indeed, even before this flooding event, we had been seeing cholera cases cropping up in various parts of Mozambique. This kind of flooding creates the perfect conditions for cholera and other waterborne diseases. So I think it's inevitable that we will see further spread. There are a number of things that can be done to help to prevent and slow that. Things like I was mentioning before, the distribution of supplies to treat and purify water, sharing information with people on how to access safe water, how to purify water, how to store water safely. Of course, the distribution of medication, vaccine drives against cholera, which UNICEF has been prioritizing in recent months, and the setting up of cholera treatment centers, and also isolation of cases to ensure that where cholera does occur, it doesn't spread further. So that's something which we're working on certainly at the moment, again, in support of government and together with our partners. But I will say that the humanitarian response and organizations like UNICEF are very much overstretched by this current crisis. Mozambique is a country where even before this crisis, there were millions of people requiring humanitarian aid and support. And we're also entering into the cyclone season. So a very big concern that we might end up with a much bigger challenge on our hands without the resources really needed to be able to address it in an effective manner.
And just very quickly, one of those I'd imagine of concern is food. Many crops are waterlogged. So, what challenges does that produce for you in terms of child malnutrition?
It produces tremendous challenges. Obviously, when children don't have access to nutritious food, their chance of developing malnutrition goes up, and that is both long-term malnutrition, which can lead to stunting and poor brain development and growth, but also short-term malnutrition, which is essentially starvation, which can lead to death very quickly. We're working with partners like the World Food Programme to support their efforts to distribute food to communities who have lost often everything. Many people living subsistence agriculture in Mozambique, and many tens of thousands of hectares of cropland have been destroyed, and animals drowned or killed through the flooding. As UNICEF, we focus primarily on treatment of children who have already developed malnutrition. So we work on distribution and treatment of using therapeutic foods and milks once children are diagnosed as being malnourished. And we also focus a lot on water and sanitation and hygiene, because one of the biggest causes of malnutrition is actually poor hygiene, where children develop diarrhea, which leads to malnutrition. So we're working together with our partners based on our different areas of expertise to ensure a holistic response that reaches every child affected by this crisis.
And we do wish you all the best, and we certainly will be checking in with you to spread the word, help out, and whatever efforts we can in the important work that you're doing. UNICEF Mozambique Spokesperson Guy Taylor speaking to us from Xai Xai in Mozambique, where he says that area has also been very badly hit by the recent